Good afternoon, and thank you, everyone. Pleased to announce yet another expansion of Alberta's COVID-19 vaccine rollout. And Alberta has a robust vaccine distribution system, and we continue to expand our approach. As of yesterday, we've administered more than 186,000 doses across the province, and that includes nearly 6,000 doses yesterday. Because of constraints on supply, we've been doing mostly second doses, which have ramped up as we follow the schedule. The first dose is done a few weeks ago, but at the same time, we've been working hard to get ready for future phases of our immunization program. And that next phase is here. Now, last week, AHS began vaccinating older seniors in group living settings, in addition to the continuing care facilities that were in our first priority. Today, we opened eligibility to all seniors who are 75 and older. And as of, I guess, just moments ago, when I last was briefed on this, we had over 25,000 appointments that had been booked so far today. And the first shots booked this morning are getting done this afternoon. As the next step, I'm thrilled to announce today that COVID-19 vaccines for Albertans 75 and older will begin to be offered at community pharmacies in the first week of March. Participating pharmacies will begin scheduling appointments today for the time slots that they have available, and this will make it easier for seniors to get their dose as quickly as possible. This is a step that just makes sense. As anyone who has gotten a flu shot knows, pharmacists have a lot of experience in delivering vaccines. They have played an important role in our seasonal flu program for many, many years, and they have the skills, they have the experience, and they have the infrastructure in place to be an important part of our immunization program. Now, those who are 75 and older will be able to book their immunization appointment at more than 100 participating community pharmacies in Edmonton, Red Deer, and Calgary. And the Ministry of Health has been working with the what we call the RXA, the Alberta Pharmacists Association, to develop a program for pharmacies to provide vaccine across the province. Now, to start off with, due to limited supply and logistics required, the vaccine will be limited to participating pharmacies, as I said, in Edmonton and Red Deer and Calgary. And we know that many pharmacies across the province are keen to jump in and assist in this immunization program. However, we must start small due to the limited vaccine qualities that were being provided by the federal government and the strict storage and handling requirements for the Pfizer vaccine. The ministry has selected the first pharmacies based on geography, as well as on population needs, as well as their demonstrated ability to handle large volumes of immunizations in short timeframes. Considerations for things like physical distancing and infection prevention and control processes are also critical. And in this first stage, we anticipate there will be a total of 102 pharmacy partners in Edmonton and Calgary, and as I said, Red Deer, to help immunize the large number of folks who are 75 and over. And I want to reassure those eligible Albertans not in or near one of these centers that they will still be able to receive their doses of the same time frame, close to home through AHS. And as we announced last week, Albertans born in 1946 or earlier can book a vaccine through Alberta Health Services online booking system or through the telephone. And those booking systems open today. What we're announcing today is even more access to vaccination through select community pharmacies. And this is just the start. As soon as we have the supply and the processes in place, we plan to expand the pharmacy program to help us get doses in the arms of every Albertan who wants to get vaccinated when they are eligible. And as more vaccine arrives, participating pharmacies and many other communities will begin to offer the vaccine as well. We are ready and we are able to keep expanding our approach. And with the support of the Alberta Medical Association, the AMA, we're working on plans to expand the rollout to community physicians as well. And we're also working on plans to develop large fast flow immunization clinics, as I've referred to them in the past, rapid flow through clinics that can be stood up at later stages. The only limit that we have is the number of vaccines available to us. And that number, and as that number expands, our approach will keep pace. Now, before I close, I want to say a word about the start of the rollout this morning. And I know a lot of folks were frustrated that they couldn't get through to book an appointment right away, and I sympathize with them. At launch this morning, more than 150,000 people tried to visit the booking site, and temporarily the AHS website was overwhelmed. And there were also long delays on the HealthLink booking appointments through the phone. And I get how frustrating that must have been. Look, one of my parents and both of my in-laws are in the age group that were able to book appointments this morning. I understand their frustration, the frustration of all of these Albertans, because this has hit home close for me as well. And so, look, it's been 10 long months in this pandemic. People's nerves are worn raw by nearly a year of restrictions, a year of uncertainty, frustration, stress, and anxiety, and about when we will be free of these restrictions and this anxiety. And vaccines are our ticket out of the pandemic, out of this anxiety, out of this stress. And so any delay in booking an appointment is yet another difficulty and another frustration for folks. So I'm disappointed, but the fact is that it's going to take time to reach everyone. We are getting a bit over 5,000 or 50,000 doses per week, and we have 230,000 seniors to cover at 2 doses apiece. It's going to take about a month to get first doses to all of these seniors. So to everybody who was disappointed this morning, I want to say that I'm with you. AHS is fixing the problems with the booking system as fast as they can, and they'll catch up quickly. The system can now handle about 5,000 bookings per hour. AHS has added network capacity. They've added staff to HealthLink. They are working directly with TELUS to make sure that any intermittent busy signal some TELUS subscribers were dealing with this morning is no longer a problem. And these shots are going to take a few weeks. We won't get to everybody right on the very first day, but we will get to all of you. And so I want to emphasize the shots are happening. The delays in getting through to the booking system will not slow down the actual vaccinations. They are going ahead as planned. And as I said, last time I spoke to AHS, 25,000 eligible seniors had successfully booked appointments. And the first shots booked this morning, as I said, are getting done this afternoon. So it's been a long road. We're taking one big step forward after another. And we're not through the pandemic yet, but we are getting through it. And so thank you very much. I'd like to invite Margaret Wing, the CEO of the RXA, the Alberta Pharmacists Association, to say a few words.
Thank you very much, Minister Shandro. I'm very pleased to be here today on behalf of the Alberta Pharmacists Association and have the opportunity to talk about the Alberta COVID-19 Pharmacy Immunization Program. First, I'd like to start by thanking Minister Shandro and for his leadership and for the commitment of Alberta Health towards mobilizing Alberta's workforce of pharmacist vaccinators. Community pharmacists have played a vital role in supporting the health of Albertans throughout this pandemic. Over the past 11 months, pharmacists have worked diligently to ensure that their patients continue to have access to needed medications, vaccinations, and trusted health information. Importantly, pharmacies have remained open, and pharmacists and their teams have remained available to their patients, working with increased safety and sanitation protocols during these challenging times in our healthcare system. We, like other Albertans, have been anxiously awaiting more supply of COVID-19 vaccine. But in the interim, the Pharmacists Association has been working with Alberta Health to figure out a planned approach to offering COVID-19 vaccination for eligible individuals by community pharmacists as more vaccine supply becomes available. Pharmacists are skilled healthcare professionals with great experience in administering vaccines safely for the public. As part of their enrollment in the Alberta COVID-19 Pharmacy Immunization Program, these same pharmacists have confirmed their readiness to meet provincial and public health expectations for safe supply, storage, distribution, and administration of COVID-19 vaccine. Over the past 10 years, Alberta pharmacists have become the leading healthcare provider of influenza vaccinations, administering over 1 million flu shots in the first few weeks of this season. I share this with you because Alberta has a proven, reliable infrastructure for disseminating and administering vaccines through community pharmacies. Having said that, there are some distinct differences between how Albertans have accessed their flu shot this year at their pharmacy and the planned approach for how eligible individuals will be able to access their COVID-19 vaccination. As Minister Shandro shared, the program will start with a small group of approximately 100 pharmacies located in Edmonton, Red Deer, and Calgary. Pharmacies were selected only in these cities due to the challenging storage and handling requirements of the Pfizer vaccine, which can only be shipped and stored at refrigerator temperatures for a maximum of 5 days. Enrolled pharmacy names, locations, and contact detail will be published on Alberta Health and Alberta Blue Cross websites later this week. Based on projected arrival of vaccine into Alberta, we anticipate that these first 100 pharmacies will have vaccine supply to start immunizing the week of March 8th. If pharmacies receive vaccine sooner, they will adjust their bookings accordingly. Pharmacy staff will be contacting seniors aged 75 and over, or those born in 1946 or earlier, to inform them of their ability to be vaccinated at their pharmacy. At this time, we ask for you to be patient, as these pharmacies will only have access to approximately 200 doses of vaccine per week, and it will take time to get all of their eligible clients vaccinated. Every pharmacy will have their own process for booking, scheduling, screening, and administering the vaccine, and we encourage you to follow your pharmacist's instructions on how to determine your appointment. Pharmacists will be booking both first and second doses of the vaccine. Individuals must be asymptomatic at the time of vaccination, and immunizations can only be administered on-site at the participating pharmacy. Remember, eligible Albertans can also schedule a vaccination appointment through Alberta Health Services, online, and through HealthLink if your pharmacy is not one of the initial sites selected to start vaccinating. These pharmacies and their vaccinating pharmacists are prepared and ready to work alongside Alberta Health Services to help expand and increase vaccinations in the community. But we know that many pharmacists and their clients are disappointed that their pharmacies have not been selected to receive vaccine at the launch of this program. However, we know even starting with just 100 pharmacies, it will contribute an increase of approximately 20,000 COVID-19 vaccinations a week, and it will help save lives. When more supply is available to the province, such as the Moderna vaccine, further expansion for more participating pharmacies is being planned. Right now, we're planning for more pharmacies to be enrolled approximately mid-March. We look forward to these first doses being administered in pharmacies and know that community pharmacists across the province are ready to do their part and work alongside AHS colleagues to safely and effectively increase COVID-19 vaccination. Thank you.
Thanks very much, Margaret. We've got a number of reporters waiting. I'm sorry we were a little delayed getting started, and we need to wrap up by about 3:15. So I'll ask reporters on the line to please keep your questions to one apiece. And operator, can we have the first one, please?
Our first question comes from Jesse Weisner, Global TV.
Well, hi, this question is for the Health Minister. Following the major delays and crashes this morning, there's a lot of Albertans wondering why this rollout wasn't done differently, such as in staggered groups based on age like other provinces have done. Why wasn't it done differently? And what changes will be made to the system for the next round of bookings? And what improvements would you personally like to see for future rounds of bookings?
Staggered by age groups. So this is phase 1B, which is 75 plus. And for the priority groups that are included in phase 2, there are 3 different groups there. And the groups of those who are 50 and over, they are going to be staggered in different age groupings as well. So that is the case now, and it is the case going forward with phase 2. What I'd like to see going forward from AHS is ensuring that the work with TELUS continues to make sure that there are no busy signals, that they continue to make sure. And look, we actually said weeks ago, and actually we've said it throughout the pandemic, that when it comes to responding to the pandemic, that money is not an issue. Resources are not an issue for AHS. And we actually did check in with them a few weeks ago to make sure that they were ready. They advised us that they were. So we're disappointed, like all Albertans. What I'd like to make sure is that AHS, knowing that money is not an issue, that we want to provide them with any resources that they need, that they come to us, we're making sure that they are deploying those resources in a way that ensures that there are not going to be delays. Now, we do have 25,000 people booking appointments. The difficulty is not necessarily in the booking of appointments, although people can be frustrated in not being able to get that appointment right away. That's not stopping us from getting the vaccine into people's arms. And there are appointments that are made this morning where people are already getting the vaccine this afternoon. And we do have the capacity, as I said, to do 5,000 appointments per hour. I think that once we do have those appointments booked, I think that's going to help with some of the anxiety and frustration that people have. But as you asked the question, and as I said, the priority 2 groupings for phase 2 are also going to be staggered in different age groups as well. Thank you, Jesse.
Okay. Thanks, Jesse. We'll go to the next question, please.
Bill Kaufman, Post Media.
Yes, Minister Shandro, I know that there are some seniors who are eligible in this phase who say that they just don't have, they're just not up to actually health-wise attending a clinic, and they're wondering if this could be done at their home. Anything you can tell me about that?
Well, that's great feedback, and thank you very much, Bill. We got an echo now in the room. Okay, great, that's been dealt with. And we want to be able to make sure that vaccines are provided to Albertans in the most safe way, considering the guidelines for COVID, and as well where it reduces wastage. And so that's great feedback to receive from Albertans. We do have to appreciate the difficulty, and the vaccines were now being provided by the federal government. Right now, the only 2 that have had approval from Health Canada have been ones that require difficult storage requirements. So we're happy to get that feedback, and I'll put that to Dr. Hinshaw and AHS, and whether there is some way to accommodate people who aren't able to attend a AHS or pharmacy, and what the other accommodations might be for those people. Thank you, Bill.
Thanks. We'll take the next one.
Next question comes from Tom Ross, 660 News.
Hi there. Since you're making this announcement on the same day that you are launching the online booking appointments, why didn't you say earlier that you're going to offer it to pharmacies? We also heard a listener today say that before this announcement happened, that they were able to book an appointment through a pharmacy. So I'm guessing they had some lead notice. I'm just curious why you didn't say this would be available on the same day that the online website launched.
Well, our commitment to Albertans is to move as quickly as we can in announcing things as they come. So we are very happy to have had this opportunity to work with RXA, the Alberta Pharmacists Association, to be able to provide this as another opportunity. We're expanding our approach and in the rollout of vaccines as quickly as we can. So yes, announcements are coming fast and quick, but it's because of our commitment to Albertans in broadening our approach, broadening the program for vaccine rollout as quickly as we can. Thanks, Tom.
Yep. Thanks, Tom. We'll take the next one.
Carrie Tate, Globe and Mail.
Hi, thanks for taking my question. Minister, I'm curious about the online glitch on the booking today. It's kind of a technical question. So we saw a research scientist post code that worked around the problem and people were able to access bookings where previously it was crashing. Given that this is like widely distributed online, why hasn't AHS just fixed the code?
Oh, well, then that's not something that I have seen myself today online from that post, but very happy to get an answer from AHS to that question. So I'll ask them to review that post. And if you don't mind connecting with Steve, making sure that we have, if Steve doesn't already have that post and a link to it, and making sure that AHS does review that and has an answer to that. Good question if that's the case. Thank you, Carrie.
Thanks, Carrie. We'll follow up on that after. And I'm sorry, we're very tight for time. We're going to take just one more, so we'll take the last question for now.
Last question coming from Rick Bell, Calgary Sun.
Good afternoon, Minister. It's nice that you're disappointed and that you're sympathetic about this screw-up this morning. But you've informed us that Alberta Health Services said they could deliver. They told you they could deliver. And for many Albertans, they did not deliver, even though they are funded very well to deliver. So is there going to be some accountability for this? I mean, after this news conference, are you going to get on the phone to AHS and read them the Riot Act and tell them this has to be cleaned up and this can never happen again, perhaps with other groups further down the line? I mean, I just don't get the sense that you're that adamant that somebody got it wrong and that they should get it right. Is no one accountable for any of this or responsible for any of this?
Well, I'll say first that I do speak to AHS often, and I'm sure there's going to be another opportunity for me to speak to them again this afternoon. And I will be expressing to them my disappointment that we have made it clear that that money is not an issue in responding to the pandemic, that we did have the expectation that this rollout would be smooth in the opportunity for over, well, almost a quarter million Albertans and being able to log in, that we did have the expectation that many people would be trying to log in at the very beginning with the anxiety that many Albertans feel, including people in an age group that is determined to be vulnerable. So I look forward to understanding from AHS the answers to my questions. And absolutely, AHS and government is accountable. We will continue to be accountable and continue to not even just providing the information regarding COVID and our response to COVID in one of the most transparent opportunities for our government to be able to disclose its response to the pandemic to the public, but also for issues like this, when people have that anxiety and have those concerns, for us to be able to answer the questions to the public and provide those answers. And if something doesn't go the way that Albertans expect, for us also to be responsible to Albertans to be able to explain not just why it happened, but here's what we're going to do to make sure it doesn't happen again. Thanks, Rick.
Thank you, Rick. I know we're leaving some reporters on the line. I apologize for that. I try not to do that, but today we're under exceptional pressure of time, so I have to close there. If you need to follow up afterward, please do. So thanks, Minister. Thanks, Margaret. And with that, I'll close for today. Thanks.